Yeah, so reducing stress and anxiety is very important to cancer, to reducing side effects of treatments, to improving our immune system. So we deal with it a lot, both in individual counseling and in our men's groups. And some of the key ways, any kind of exercise. So our men in our men's group do anything from golf to hockey to working out in a gym to yoga. They all have different methods, but they all encourage each other to have a regular form of exercise. It creates endorphins, which helps you to feel better, relax more, and in the same token, it helps you fight some of the fatigue that you might have related to your cancer. So that's the number one thing is exercise. We have a healing arts program here where we teach meditation. We have gentle yoga, restorative yoga. So anything that can help the worry. So we get prostate cancer and the mind just won't stop worrying. There are techniques that we can teach you called cognitive behavioral therapy, sometimes meditation, sometimes other type of therapeutic approaches that will stop that anxiety and worrying and put something else in its place. We can manage that and control that, but it does take some skills and techniques that you might not have needed before you got diagnosed.
For someone who comes to me who's been newly diagnosed, or really anything, any kind of stress, one of the biggest things that I try to help people with is the idea that avoidance of stress or avoidance of disturbing emotion causes more of it. And what I've seen in my practice over and over and over again is that when we learn how to create a space to allow these emotions to exist in a safe way, that is when the shift actually happens. Versus when I actually had a patient in not too long ago who was a cancer survivor, different cancer, but he came in because he was very worried about his stress level and he knows he doesn't want to relapse. And so he was very worried about that. And so when we got really into it, you could see his like resistance to, oh, I can't feel this, which for me makes this, whatever this is, bigger. The resistance to it strengthens it. So I help people bring it in, whether it's anxiety or worry or anger, bring it into the room in a way where we can connect to it, talk to it, almost like it's a little bit separate from us, create a little distance between us and that emotion that feels so scary. And when we do that, we learn that, whoa, okay, one, this thing might not be what I originally thought it was or what I assumed it was about. When we actually invite it in and invite it into a conversation, I tell people, have coffee with it. Make it a cup of tea. Talk to it, ask it questions, and then listen. So I don't want to get too detailed into that, but really one of my biggest foundations is that I don't want to hurry up and fix it. I don't want to hurry up and find strategies to make it go away. I want to bring it in. I want to exaggerate it in a way because I really want to connect with the energy and consciousness of that emotion or that disturbance because I do feel like it's there to help point a direction. So I want to talk to it.